Good evening, guys. I have discussion C for you. We are discussing osteoporosis fundamentals and understanding bone density loss and fracture risk. So here we go with the presentation I made for you. Please enjoy. The page features a Talking with Docs video titled Osteoporosis Fundamentals, Understanding Bone Density Loss and Fracture Risk, a clear clinical guided introduction to how bones change over time and why those changes matter. The video sits within a broader collection of health explainers, and its purpose is to give viewers a grounded, medically accurate understanding of osteoporosis and what it is, how it develops, and why it becomes such a powerful driver of disability and loss of independence as people age. The tone is a practical and educational, aimed at helping the public grasp the indivisible processes that make bones fragile long before a fracture ever occurs. Core concepts covered. Definition: osteoporosis is framed as a progressive condition in which bones lose mineral density and internal architecture, becoming more porous and brittle. This isn't just weak bones, it's a structural transformation that reduces the bone's ability to withstand normal forces. Mechanism. The video highlights the lifelong dance between bone restoration, breakdown, and bone formation. Building in youth, formation outpaces breakdown. With aging, hormonal shifts, especially the sharp drop in estrogen, often menopause, tip the balance toward loss. Certain medications, chronic inflammation, and nutritional deficiencies further accelerate this imbalance. Consequences: as density declines, bones can fall under stresses that once seemed trivial. A mishap, a twist, even a cough in severe cases the video underscores that fractures are not random accidents, but predictable outcomes of underlying skeletal fragility. Key risk factors highlighted: age and sex. Bone loss accelerates with age, and postmenopausal women face the steepest decline due to hormonal changes. Nutrition and activity. Insufficient calcium or vitamin D, along with sedentary lifestyle, deprive bones of the raw minerals and mechanical stimulation they need to stay strong. Medications and medical conditions. Long-term steroid use, certain cancer treatments, and thyroid disorders, and autoimmune disease can all hasten bone loss by disrupting the body's remodeling processes. Typical fracture sites and clinical importance. Common sites include the hip, spine, and wrist, where bones structure is particularly vulnerable to density loss. Clinical impact. Hip fractures often require surgery and can lead to long-term mobility loss. Vertebrae fractures may cause chronic pain, heightened loss, and spinal deformity. Wrist fractures can limit independence, daily tasks. The video emphasizes that these injuries are not merely painful, they can trigger a cascade of decline, from reduced mobility to social isolation and increased mortality risk. Osteoporosis is presented as a major yet largely preventable contributor to these outcomes. Practical takeaways and next steps. Screening. Viewers are encouraged to talk with clinicians about bone density testing, especially if they are over the recommended screening age or have identifiable risk factors. Prevention. The video reinforces the power of everyday habits, weight bearing, and resistance exercise to stimulate bone growth, adequate calcium and vitamin D intake. Smoking acceleration. Moderation of alcohol and regular medication reviews to identify drugs that may weaken bone. Let's see. Then we've got action here. The overreaching message is empowerment. If you or someone you care for may be at risk. The video aims to spark proactive conversations with healthcare providers about assessments, prevention, and when needed, treatment options that can slow or even halt bone loss. Myth busting version tailored to your public education work. Below is a explanation of osteoporosis grounded primarily in the surrounding page content from the Mayo Clinic article you have opened. Okay, meaning of osteoporosis. On the page you are viewing, osteoporosis is defined as a condition in which bones become weak, brittle, and prone to breaking. The surrounding content emphasizes that bones can become fragile and even minor stresses, bending, coughing, or small fall can cause a fracture. The page frames osteoporosis not as a sudden event, but as a gradual imbalance. The body loses old bone faster than it can build new. How the page explains the condition. Number 1, bone biology and the root problem. Bone is living tissue, consistently being broken down and rebuilt. In youth, bone acceleration outplaces bone loss. With age, especially after about age 30, bone loss accelerates and bone formation slows. Osteoporosis develops when this balance tips too far toward loss. Who is most at risk? The page highlights several non-modifiable risks. Sex assigned births. Women are far more likely to develop it. Age. Risks risk raises steadily with aging. Race. Highest risk in people who are white or African or Asian descent. Family history, especially if a parent had a hip fracture. Small body frame, less bone in reserve. It also details modifiable risks such as low calcium intake, sedentary lifestyle, smoking, excessive alcohol, and long term steroid use. Symptoms often visible. The page stresses that osteoporosis is usually silent until a fracture occurs. When symptoms do appear, they often include back pain from a collapsed vertebrae, loss of height, stooped posture, a bone that breaks more easily than expected, serious complications. The most dangerous outcome are the most dangerous outcomes are hip and spine fractures. Hip fractures can lead to disability and increased mortality. Vertebrae fractures can cause chronic pain, heightened loss, and a hunched posture. 5. Prevention emphasized on the page. The surrounding content highlights adequate calcium and vitamin D, weight bearing and strength training exercises, avoiding smoking and limiting alcohol, fall prevention strategies. In short, based on the page you're viewing, osteoporosis refers to a progressive loss of bone density that makes bones fragile and highly susceptible to fractures, especially in hip, spine, and wrist. It is common, often silent, and strongly influenced by age, hormones, and lifestyle and genetics. Myth busting version of your dementia care education work. All right, guys, that's tonight's shows for now. I will see everybody tomorrow for shows, or if I jump back on later, we will see what happens. For now, Gator Wellness, take care, folks.